I am Dr. Manish Kumar Yadav, Consultant Intervention Radiologist at KIMSHEALTH, Trivandrum. Today I'll be talking about stroke. What is stroke? Stroke is a kind of brain paralysis, what we know as. There are multiple causes of stroke, but broadly it can be divided into two types. One is in which there is a bleeding inside the brain, and second is where there is occlusion of the artery of the brain. These are known as hemorrhagic stroke and ischemic stroke respectively. So what is hemorrhagic stroke? Sometimes whenever there is a bulge in the artery of the brain, this bulge, abnormal bulge, can become big and it can rupture, resulting in hemorrhage inside the brain. What happens when there is bleeding inside the brain? It is a very severe condition and sometimes it can be life-threatening. How it can be treated? There are broadly two ways of treatment. Traditionally, it was being treated by open surgery and a procedure called as clipping, where a small metal device was used to occlude these normal bulges. But today, all across the world, this kind of hemorrhagic stroke can be treated by endovascular procedure. What is endovascular procedure? Here, the blood vessel or the break in the blood vessel can be treated without surgery. So there is no need of opening the skull, no need of having any dissection of the brain matter. This all can be done through a small pinhole through the leg artery or the artery in the wrist, just like a cardiac procedures which we are very familiar with. So through the artery of the leg, a small tube is taken inside and then this bulge is treated without any open surgery. This is considered the preferred mode of treatment all around the world. Coming to the ischemic stroke, sometimes a clot may form inside the heart or somewhere in the brain vessel, and then it occludes an artery. Whenever the artery is occluded, supplying a part of the brain, it results in ischemia and the part of the brain dries. So the symptom of the stroke depend on which artery has been occluded. To make it easier to identify stroke, there is an acronym which is known as BFAST. So the B stands for balance. If you see somebody who is not able to hold his balance, it may be a sign of stroke. If somebody is complaining of a sudden onset of visual difficulty or not able to see, or he is having a double vision, it may be a sign of stroke. Coming to F. F is the face. If you see somebody's face is deviated to one side, or there is asymmetry of the face, or the appearance of the face has changed suddenly, it can be a sign of stroke. Then A is for the arm. If somebody is not able to lift his arm, or when we shake hand with him, his hand grip is weak, it may be a sign of stroke. Next is S. S stands for speech. If somebody has change in his voice or change in his speech, or is not able to talk properly, or the speech is incomprehensible, it cannot be understood, it can be a sign of stroke. T is stands for time. That whenever you see any of these symptoms, it is time to seek for a medical help and go for a stroke ready hospital.